I pushed record. For all those who have joined, I see there's quite an attendee list here. It's great. We had an awesome lineup today. We had talked to follow up on last week's conversation, or 2 weeks ago. Doug had brought our attention, or brought the attention towards what Saratoga is working on and looking to do potentially with ComCare, Blue Raster, the geocoder. So I've invited Gerard Aiken, as well as I think Gerard, it's Jing Wu.
Yes, we have Jing Wu on with us, as well as Jonathan, and I think Mark Scott will be joining us as well.
I saw
Devin Hurd as
always
always.
as well.
Yep, Devin's always on, right?
Devin's on, yep. And as well, on top of that, the second agenda item, Dr. Gretchen Culp, I asked her to join the call. She's with the Surveillance and Epidemiology branch of COVID-19 in New York City Department of Health and Mental Hygiene. And she's doing some real cool geocoding stuff with a geocoding package for R that she was got to give us a little information about what she's doing there in New York City with that. So, and other than that, I have an open agenda. So obviously we always have some great conversations. And after saying that, I'd like to hand over the virtual Zoom meeting to Gerard Aiken, or Jerry Aiken.
Thank you, Ross.
One thing real quick, sorry, Jerry. Yeah. Can everybody that's not talking or presenting, please mute themselves just to get some of that background noise out. Thank you.
And what I'm going to ask is I'm going to ask Jing to get her presentation up and take control. So can you do that, Jing? All right, and Jing is going to walk us through. Let me introduce everybody from the ESRI side. Devin, you know very well, and especially in New York City and out on the island. Jerry Aiken, I know a lot of you. Just introduce myself. I'm an account manager such as Devin, but I handle everything north of the boroughs, basically. Devin has Westchester County itself, but I have everything else north of the boroughs to the borders. Accompanying me is Mark Scott, who's a solution engineer out of our Boston office. If you've been around GIS for a while in the Northeast, I'm sure you've run into Mark. Also with us is Jing Wu, and Jing is in our public health team, and she is an account manager as well, but she specializes in public health. Fun fact about Jing is that she was a pharmacist for years and is a licensed pharmacist out of Wisconsin. And she came over to join us, I believe, a year or so ago. And then Jonathan is joining us, and I believe from out in California, and he is a solution engineer that works with her. So, and I thank them both very much for coming on board and giving this sort of presentation. We're going to talk about community contact tracing and touch as well on a newer deployment or solution of our technology focused on vaccine distribution. We actually believe that this will be more important in the end, but we want to talk about what community contact tracing is, and then what the counties that are looking into it, exactly how they were going to implement it. I'm getting some feedback, and I'm sorry if you're on the phone, could you please mute? I apologize for asking that, but we're getting some back and forth feedback there. Jing, I'm going to hand it off to you to get rolling.
Thanks so much, Jerry, and nice to see the W's being thrown up there. Nice to see you again, Doug. Always nice to see someone who appreciates Wisconsin on the line. But I know today our time is pretty brief, and we're going to be covering quite a bit of material. So I'm just going to jump right into it for community contact tracing and vaccine distribution solutions. So really where all this stems from, and actually I'm going to stop my video just in case there's going to be a feedback issue, which we've had in the past. So with the continued rise in COVID-19 cases in communities across the world, we wanted to share with you an upgrade to traditional contact tracing workflows that is very similar to a framework that you can use for distribution as well. We call this approach community contact tracing, which we will focus on for the majority of our demonstration today. However, to emphasize the importance and usefulness of including location intelligence as part of your community's COVID-19 response, we also will share with you how you can take a small twist on the ArcGIS platform technology to address vaccine distribution as well. So on the ESRI Health and Human Services team, our role is to support health organizations, and we have seen how GIS provides both a framework and a process for COVID-19 response. Reliance on GIS during the pandemic included real-time data sharing, analysis, planning, visualizations, and capabilities that are all critical for contact tracing, but also testing and treatment site selection, as well as equitable and speedy vaccine distribution and more. Community contact tracing supplements your traditional contact tracing workflow, and it clearly delivers benefits, particularly taking analytics outside of just the individual and putting them in context of their surroundings within the community. Our technology allows you to find the commonalities and patterns in your case data. It helps you guys understand how cases and contacts and places are connected. And it also helps you discover new actionable insights about community spread. All of this is very important in helping communities make more effective and informed decisions to protect their public from COVID-19. So what all this kind of centers around are these 5 broad categories where GIS generally supports public health, whether it's in the collection and management of data, whether it's in the analysis, or whether it's helping public health organizations understand all the options that are available for them by enriching with geospatial data. Oftentimes we see health organizations use our technology to engage with internal and external stakeholders, whether it's helping them become part of the decision-making process, adding context to what's going on, providing feedback. So we see a lot of that two-way engagement. And ultimately the goal is to help teams make the most strategic and impactful decisions, which they can adjust or maintain through monitoring. Essentially, we have seen 3 main patterns, and ESRI has a scalable solution for both community contact tracing as well as vaccine distribution. So generally, we see these patterns. One is that some organizations are looking for a complete solution that handles the entire contact tracing workflow from case investigation through location analytics and decision support. Others want to integrate with and build on their existing case management system by adding location data and analytics. And some organizations have a case management system that is already collecting location data. And in that case, ArcGIS can provide the analytics to support informed decisions. So ESRI can support any of these patterns. If you are currently working with a paper-based or manual workflow, ESRI provides that complete case management system that digitally transforms your workflows and delivers the benefits of whatever COVID-19 workflow you're trying to accomplish. This includes the digital workflow for gathering case and contact information, data management on premises or in the cloud, the powerful analytic tools, the portal for data sharing, collaboration, the dashboards, and web apps to support the decision makers. The workflows are supported by out-of-the-box configurable software. These are all part of the ArcGIS integrated location intelligence platform. You can deploy ArcGIS as your case management system and support case investigation, contact tracing, analytics, and decision-making. And if you already have that case management system, that's where we integrate with the other systems to help you collect and manage and analyze the location information. This includes the tools you need to perform contact tracing, so you can leverage the new information and make those decisions that are needed. Otherwise, if your case management system is already collecting the information, oops, I have a meeting invite. We can deploy the tools you need to take advantage of this. So that's just another option. Finally, also, we wanted to touch a little bit on vaccine distribution as well. So the main things that ArcGIS is supporting vaccine distribution on is the planning and distribution efforts. the vaccine campaign portion in terms of communicating with specific neighborhoods and populations where vaccine hesitancy or communicating the risks and benefits of the vaccines effectively will be very important. And then also providing real-time awareness and transparency. So there's just a brief list of some detailing in more detail about these three main pieces, which is, figuring out which populations are most at high risk and details about vaccine management and inventory, something that we can certainly go into greater detail during the demonstration. Finally, the last thing I want to touch on before I hand it over to Jonathan to provide his demonstration is that we understand that data used in contact tracing and in health in general is very sensitive. And we do have two options for data management in that respect, and you can select the option that meets your security needs the best. So ArcGIS Enterprise is deployed in your infrastructure and allows you to configure the security and privacy settings to meet your requirements. And you can evaluate ArcGIS Enterprise as a purely internal system to support contact tracing and keep the data within your infrastructure. For ArcGIS Online, it is very scalable and a reliable SaaS option that meets many organizations' requirements for securing sensitive data. If it satisfies your security and privacy needs, then ArcGIS Online allows you to quickly configure contact tracing workflows and vaccine distribution workflows in the cloud. Ultimately, which you use is up to you. Both can support various COVID-19 workflows. So I'm going to stop sharing my screen and I'm going to let Jonathan take it away.
Thank you, Jim. So let me start sharing my screen here. Let's see. There you go. Could you let me know if, could you see my screen?
Yeah.
Yes, I can.
Hey, Jonathan,
Excellent.
can you move your microphone just a little bit closer to you?
Okay, let me
Thank you.
see. Can you hear me well?
Yes. Okay, thank you.
Perfect, thank you. Yeah, so as Jim was mentioning, data management is critical whenever we talk about contact tracing. So some of you are working with different systems. The state normally work with the electronic disease surveillance system, also known as NETS. But we are aware that there are other systems out there, Comcare, MVP, Salesforce, and different other systems that are helping you to manage your information. So the first point I want to make during this presentation is that we can support interoperability. Here, I want to start showing you a very quick workflow. This is one of our applications. This is a GIS desktop application called ArcGIS Pro. And we have an automate task that will help you to basically get an extract from any other system, as long as you can export your information on cases, contacts in a CSV format. We can take that CSV and basically import that CSV. Let me run this again. Oh, I have a window here. Give me a second. There's a problem when you have so many tabs in the application. It's running. So basically what we are doing is we are taking an extract, a CSV extract, and importing that into our system. As an output, what you will get is that information geocoded, as long as you have a geographic reference, and then you can have that information in the system. Once the information is in the system, the second step is to start with the case assignment process. So what you are seeing here is a case assignment dashboard. You can see that we just imported 8 new cases using the automatic task. And now we have a very simple 3-step process that will guide the contact or case investigator through the process. The first step is, selecting one of the new cases. You can see on the right side that all those cases that are in red are the new cases that we just imported, and those cases are waiting for assignment. So we select this case, Samuel Hauser, and then I can take advantage of the investigator availability chart to see the workload for each of my investigators. In this case, we have 4. Again, this is a dashboard that you can customize. You probably have more than 4 investigators. You can basically modify those charts as you need. So in this case, I can see clearly that Amy is the case investigator that has the least workload. So I will select Amy here, submit this, and automatically this dashboard will be updated. So now you can see that we have a new assignment for Amy. This case now can be started. So once I have that assignment, I will change my role now, and I will be an investigator. So for that, I can deploy this investigation, case investigation application. This can be deployed on a desktop application. This can be deployed on a cell phone. This can be deployed on any device. In this case, I will use my desktop application. I will start with my case investigation. And the first step is to check what are my new assignments. So you can see that Samuel Hauser now is a new assignment. I will start with this investigation. And here I want to stress 2 main points. The first is that, as you can see, this investigation now is tied to a user. That means that if I want to do quality control at one point, I can definitely check all those investigations tied to a specific user and validate that information. The second thing I want to stress is that all the information that I imported from the CSV file now is pre-populated in the survey. So what we want to do here is to minimize the time an investigator takes to do this process. Once I validate that information, say that, for example, I start the investigation and I am in a call with this person, I can validate that information and I can start asking the key questions for the case investigation. So let's start with when was the first time this person felt ill? Let's say October 12th. And then I can start entering information related to signs and symptoms. Let's start with, for example, chills and changing. And then I can add as many symptoms or signs as I need. Now, what happens if you find a very dangerous symptom, like, for example, bluish lips or face? In this case, you can terminate the survey and basically activate a trigger to notify the emergency department to really take care of this specific case. For the sake of this demo, let's skip this process just to show you the other steps. And let's start collecting contact information. So let's start here with contact information. Let's say Jean, and she was exposed to this specific case on the 19th. We enter the phone number of this contact and then some information related to this contact. As you can imagine, you can enter as many contacts as needed, right? And the average is from 5 to 7 normally, but you will find specific cases where you have more than that. And here is when we will enter the secret sauce of the solution, which is visited locations. And here we have optimized this process for your case investigator. Because whenever they will be asking this question, what places or which places have you visited during the last 14 days or during the infectious period? They most likely won't remember a specific address, right? They will say, you know, I don't remember the addresses of my friends, or I don't know the address of the closest Walmart to my house. I don't know the exact address, but I do remember that I went to Walmart. So this, as some of you know, you definitely can take advantage of those point of interest names. So if I enter Walmart and then Redlands, what the geocoding system will do is identify that point of interest, and as a result, you will get a full standardized address. So I can get the address and enter this and save a lot of time my case investigator. One more thing here is that you can enhance that geocoding process. because many of you have better data when it comes to point of interest information. You can integrate your own point of interest data and make this geocoding process very easy and smooth for your case investigator. So again, as you can imagine, you can add as many locations as you need. Once you are done with the locations, you can enter some supporting information. But for this demo, let's just submit this survey. And there you go. We have a complete case investigation. Now, once you are done with the case investigation, the next step is the contact assignment, right? So here, for example, you can see that now we have Jean W as our new contact waiting for assignment. And she is on the bottom of the list because of the date of exposure. What we want here is to minimize the number of days a person that has been exposed to COVID is moving around our community. We want to really have effective quarantine for these people. So this list always will prioritize those people that has been the longer time exposed. For this, let's go ahead and select Jean. And you can see that we also have a mechanism to validate duplicates. This is a common process for you because when you are collecting information on contacts, especially when they belong to the same family, you will find duplicates. And we have different mechanisms to validate those duplicates, whether it's for the phone number, maybe a combined field that takes different information to create a unique ID for that specific contact. We can implement different workflows for validating those duplicates. That's an important step. Once you validate that Jean doesn't have any duplicates, you can assign this contact now to a specific contact investigator. In this case, again, we see that Brad is the one that has the least amount of contacts. So let's go ahead and assign this. This is not a duplicate, so submit. And there you go. I won't repeat the process for contact investigation. I think you get the point. You just go ahead to the inbox, check what is your new assignment, and start with the investigation. It will be the same process that I just showed for cases. Okay, so what happened once you finish with the contact investigation? So once you are done with this investigation, the next step is to monitor that contact. So what you have here is a contact tracing dashboard. You can see that we have new assignments. These are new contacts. But also we have a list here that shows wellness check monitoring. And basically those are contacts that have accepted to be notified by the health department to self-report their status. And we can help you to implement that kind of monitoring. Some of you are using SAR Alert, some of you are using different other systems, but if you are thinking on implementing a system that directly integrates to your geographic information system, we can help you to do that too. Let me show you how that works. I will open here this survey. This is the survey that a normal contact will receive. And then let me open my cell phone here. Let me unlock my cell phone. There you go. So here's my cell phone. I am mirroring my cell phone right now. And what I will do is, let me see what is going on with our server. Let me try again to mirror. That happens when you don't turn on your cell phone quickly. There you go. So we have the cell phone here to the right and the survey here to the left. So I will enter Jean. She wants to be contacted via SMS. I enter the phone number, submit. And what will happen is she basically is accepting to be contacted via the SMS integration. And you can see that I got an SMS. And the health department XX is notifying me that I can do my daily wellness check now. I can open the link. I can be directed to a wellness check monitoring survey. In this case, it's the same survey, but you get the point, could be any survey. And you can start monitoring each of your contacts. So this is just a sample of one of the ways that you can integrate your system. This is one of the partners we have, in this case, Tulia. So this is, so far what we are doing here is data management, right? We are collecting information, we are monitoring information, we are mapping information. Now, the second step is, what do we do with that location information? And here is why we at ESRI really try to foster that idea that community contact tracing is really important. And what I will show you now is the analytics. So what you have here is a table that is being fed by my surveys, right? So this table already have X and Y coordinates because we are collecting the fully standardized addresses. So the system behind the scenes is just getting the X and Y. And quickly, I can map now that information. What you are seeing here are all the locations that my contacts have been reporting, right? So now there is a specific symbology here. You can see that there are different sizes here for those circles. The bigger the size of the circle, the higher the number of contacts that have reported being on that location. So you clearly can identify that there are some locations that have 49 reports from my contacts. So that quickly tells you across your community where potentially you have a lot of exposure to people from these contacts that maybe are already confirmed cases. Next, what I will do is take advantage of one of the very interesting charting capabilities we have here. One of those charts is called link chart, and I'm pretty sure you have heard about those. But let me show you how quickly you can create those charts. I just need to select the contact ID, the place, and now we have this chart that is showing me two different colors for my circles. The blue circles here represent places. So as you can imagine, the bigger the circle, the higher the number of contacts. And these orange circles are, in this case, contacts. And the bigger the circle for my contact, the higher the mobility of that contact. That means that this contact, as you can see in the map, has visited many locations during the last week or the last 14 days. Now, when you do this with your own information, probably you will have thousands or maybe hundreds of thousands points. So how do you prioritize your efforts when it comes to identify those high mobility contacts or high density locations in your community? Well, you can do that using charts here too and filters. So what I will do is I will select place here and create a very simple chart, the column chart. And now what I will do with this column chart is filter this information to only see those locations that have more than 10 reports. We'll apply this. And as you can see, I have my top 5 places in my community in terms of the number of reports I am getting. You can do the same process for those contacts with high mobility. So quickly, you can identify in the community where maybe you can have more granular social distancing policies, where you can target specific campaigns across the community to minimize that exposure for potential confirmed cases in this case. Now, what happens if you ask the question, okay, I know where I have a high number of contacts in that location, but I want to know if those contacts were at the same place at the same time. And you can do that because as you saw in the survey, we are also collecting the date of exposure or the date of visit for each of these locations. So what I will do is I will select this date field, select date of the month, and then place. And let me create a chart here. Let me do that in the other way. First place, the date of the month, So it has a more meaningful rate. There you go. Now it's horizontal. And what I will do is select my top place, home plus. And now you can see over each of the days of the last month, the number of contacts per each day. The more purple the color, the higher the number of contacts on that specific day. So if I go to day 23rd, you can see that in Home Plus, we have 5 cases, in this case, 6 cases. And 2 of these contacts had high mobility. So you get a point here. You can see trends over time. In this case, I am exploring these over each of the days of the month. But maybe what you want to do is analyze your whole information and see if there is any trend in terms of days of the week. So again, place, let me do this again, place, date of the week. If I select heat map, then we have from Sunday to Saturday, and I can filter this information and see, for example, that here we have a trend during the weekends, and that makes sense, right? So Saturday is the day where we are having a higher concentration of people in those specific locations. And you can start analyzing this over time for each of these potential clusters of contacts. So this is just a quick example. At the end of the day, what you can do is put together this kind of dashboards where you basically, let me see if I can, there you go, where you can basically compare the concentration of contacts per census tract, compare that with vulnerability, because you know where do you have these clusters of contacts, but also you want to know where do you have vulnerable population that can be exposed to those contacts that have high mobility. And that definitely will drive decisions. Now, at this point, the last step will be monitoring. And just to finish with this process, we do have some of these dashboards that will help you to monitor key factors when it comes to contact tracing. As we know, an effective contact tracing process depends on the timeliness of case identification, case isolation, and quarantine of contacts. So here, for example, we have some metrics that are key. We can see that 73% of my total case population has been reported within 24 hours of specimen collection. Or in this case, we can modify this indicator just to say, you know, how long it's taking me from when I import my data into the system to conduct the case investigation. And that will give me a really important KPI to understand how well I am implementing this process. Another thing that you can do is identify those cases in this example that require social services, as well as cases that require out-of-home isolation quarantine. So here, for example, I am filtering that information. And then I can go to my map and activate that layer that shows me that alternative housing services. So I can see what are the closest or the closer services for these specific cases and notify them of those resources. This is just one example. The point I want to stress here is that you can configure as many of these dashboards as you need. It doesn't require development. It's just a configuration process, and you can get dashboards like this one where we have, you know, cases by status. And at just one glance, you can get information as you need for your health department. So I will make a stop here. This is kind of the 3 steps for contact tracing. And before I jump into demoing vaccine distribution, I wonder if there is any questions, comments. I would really like to make this more like a conversation. We have a lot of experiences implementing this system in different health departments.
Anybody? Anything for Jonathan? All right.
Yeah, actually in the chat, I did see that Mary Susan asked, what is the long GUID for? unique identifier for the client, or does it identify the phone?
Good, that's a good question. Yeah, so for this demo, we are using just the phone number, but we have cases in different other health departments where they use a combined ID, right? They will use, for example, they will create a subset of the address combined with phone number, and then they will use that as the identifier. But you can implement your own mechanisms. I know that you, in each of your health departments, have different methodologies, and we can adapt to those methodologies to identify duplicates too.
I'd really like to talk with someone about adapting the United States national grid as part of that, a unique identifier, as an alternative potentially to trying to mash up using an address.
That is an excellent idea that we would, yeah, we used to do that at FEMA. It is an excellent idea to protect that PPI information.
And I'm sorry, who was speaking?
Oh, I'm sorry, that is Gerard Aiken.
Hi, Gerard, thank you.
You're welcome, Mary.
Excellent comment. Any other comments? Okay, so if there is no other comments, let me jump into vaccine distribution. Again, we are using the same framework when it comes to vaccine distribution. I understand that almost every health department, if not every health department, has submitted their distribution plans on the 16th. So we have experience dealing with some health departments already working on how we can support that process to effectively distribute the vaccines. So the first step is to gather data, right? And what you need to do, according to the CDC playbook, is to quantify to some degree the population that need the most these vaccines. And you can, I really want to make a point here, because whenever you are dealing with ArcGIS, you have an complete ecosystem that you can leverage. And in this ecosystem, you can access to ready-to-use layers that you can use for this process. So one of these ready-to-use layers is the one that you are seeing here. We have estimates for each of the phases for the vaccine distribution. In this case, I have a dashboard for every state. I am just filtering this information for New York. And you can see that if I select phase 1A, we have an estimate for each of these phases, in this case, phase 8 across the whole state. If you are asking right now how we came up with those estimates, we were following the CDC guideline and taking advantage of the demographic data that we have on the platform. We created those estimates. Now, this is just one way to create those estimates. You can take this methodology, you have access to the demographic data on the platform, and you can leverage this, improve it, and create more granular outputs for your own health department. The point here is that we have information related to comorbidities. We have demographic information that you can leverage. This is just one example, in this case for New York State, of estimates for each of those phases for the vaccine distribution. So this is one of the components when it comes to vaccine distribution: quantify your demand. The other component is establish your distribution network, right? And some of you already have your partners using your immunization system. You have been partnering with a lot of institutions already for different other vaccines campaigns. So you do know where those partners are. But also you are looking for more partners in order to reach those areas where you don't have an appropriate coverage. So what you can do is, we do have also information across the whole United States on locations for hospitals, pharma, retail, and so on. Here, for example, we have this layer that you also have access in the ArcGIS ecosystem that is coming from Definitive Healthcare with the locations of all hospitals across the United States. You can filter these by type of hospital. You have information on the total number of ICU beds, licensed beds, ventilators, and so on, and staff, which is kind of an important point when it comes to vaccine distribution. But also you have access to, as I was saying, pharma locations. As you know, Walgreens and CVS are formal partners right now for the vaccine distribution. So you can get access to those locations and also include that in when you are creating your distribution network. Once you do that, the second step is to leverage those locations and then start simulating scenarios for the distribution. So here, for example, we took the main hospitals and some of those pharma retail locations, and we simulate a scenario with an X number of capacity for each of these locations to outreach every county across this state. This is Iowa. So you can see clearly that 94% of the population is successfully outreached in a 60 minutes driving time to each facility. But we have 6% of the population that will have to drive more than 60 minutes to get the vaccine. So quickly, you can identify those areas where you may like to find new partners, right? And you can clearly quantify those numbers, quantify each of the phases too, using the demand layer that I just showed you a couple of minutes before. So the next step, once you do these analytics, is to simulate scenarios to outreach these 6% of population. And for that, we do have also applications like this one, where you can specify a new location, quantify the population that you would serve if you deploy a new point of dispensing here, or if what you want to do is leverage a partner instead of a point of dispensing, you can go ahead, identify the location of a partner, in this case Walgreens, and then simulate what will be the outreach of this partner, in this case specifically, let's say 50 miles, in terms of the population that you want to serve. So this is a quick example of how you can leverage not only the data, but also the analytical capabilities of the platform for improving and enhancing this strategy that you have to put together. Finally, Jim was mentioning effective communication, and many of you have experience with our hub platform. You know that we are able to show effectively our information products to the community, key statistics to the community, so they can receive that information in a digestible way and being updated, and not only inform the community, but to create a two-way channel with them where you can hear them, and you can collect information from them too. So this is just a quick example and overview on vaccine distribution. At this point, I can open the floor for any questions regarding any of the demos you just saw.
How can you not unmute yourself right when you want to unmute yourself? I apologize for that delay there. Jonathan, that's a wrap?
Yep.
Okay. Folks, thank you very much. What I'd like to share with you is that the questions were about Saratoga implementing this as well. So we wanted to show you what they were planning on implementing. The vaccine information is actually relatively new, so they don't have that plan just yet, but I wanted to share that with you. The way that they are going through this is because they're a really client with a lot of growth. They don't have a lot of our tech in there. So their growth mechanism was through enterprise. This is going to be deployed through an enterprise installation. They were acquiring a lot of training for their people and some desktops. And then we brought in Blue Raster. Blue Raster is a contractor or one of our business partners. And Blue Raster was going to be doing the technical implementation of the enterprise, so one of our enterprise jumpstarts. They were also going to be doing the solution deployments, and they've been working specifically with us on this pattern since summertime. And they were going to be deploying the COVID-19 contact tracing workflows, data management, and solutions for Saratoga County Public Health. And then a large part of that mechanism is because there is not a big GIS team in Saratoga County, they were going to need some support to ensure their success. So Blue Raster also factored in there about 150 hours of support moving forward for Saratoga County to ensure that people were successful, that the project was maintained and grown, and training some of their newer resources to move that forward. So that is what Saratoga County was getting. This is very customizable. So any county could be, well, you have an enterprise, you don't need that software. You have plenty of desktops, you have plenty of support. Then really what we're going to do is we're going to show you how to roll out the solutions and the workflows. And we could do that ourselves or bring Blue Raster into that, depending on what your financial needs are, what you want to achieve. Do you want to deploy it, or do you want to deploy it and have additional support? It becomes a value statement at that point in time. So that is where we were with Saratoga. That is what we have talked to some other counties about and where we hope to proceed forward.
This is Al Leitner, a statement and then a question.
Yes, sir.
Firstly, it's way back, maybe around June, we went out and solicited volunteers to help with any kind of GIS support for dealing with COVID. And we have a listing of 115 or so people from the New York City metro area, but I think also across the state, who are GIS qualified or at least have experience or schooling. And that is a resource which we can make available, I suppose, to any county in the state to help out with any kind of GIS implementation. The question I have is, how long will it take, or would it take, let's say in a GIS sophisticated county, to implement this application?
I'd like to say that we could probably get the first solutions up in 2 days. Depending on the data structure and how the data is being worked, I don't think it would take longer than 2 days to get the first solutions up and then move them forward. No longer than 40 hours.
Thank you.
Any other questions? Anyone? Okay. Thank you all very much.
You bet, Gerard. Thank you. Jin Woo and Jonathan, thank you very much for taking the time to show us this. It's a very comprehensive contact tracing platform. And if there are any more questions, I will surely pass them along to you. There are a few questions popping up in the chat. Jin Woo just said the most recent vaccine resources. She just posted a link for that up on the chat. Mary had a call or a question. Why isn't there a statewide rollout, or is there any plans for anything statewide? Unfortunately, Frank had to jump on. I think he would, or maybe Gerard, have you spoken to Frank or done any statewide?
Yeah, Paul Rooney has been engaged with Frank Winters on this pretty extensively. Right now, the state public health is asking people to use the ComCare tracing system for their workflow and data management. And we see our solution as sort of a bolt onto that to get that geographic location and analysis down. So it's not a replacement. It's purely an enhancement to the existing system. And we are actually pursuing that with the state as well as with ComCare themselves. But the counties are the people that have the boots on the ground. And they're the ones that need to influence their counties, their citizens in the county more than anything. So this is where we're trying to roll that out to.
Want an interop style bake-off. Let's get this going, guys. Really. Come on.
It's a great tool. And I'll tell you, the vaccine part is the part that actually makes me more excited. Like that is really where I think the future is.
Sarah Leitner, again, I have a question about whether either in the implementation with Saratoga or others you might cite, the degree to which this has really driven down the COVID rate. Do you have any statistics on that?
No, we do not, because we do not have a full implementation. We are still awaiting funding from Saratoga, to be honest with you. They are going down their grant path. Across the nation, we have seen decreases in COVID numbers in counties where they're implementing this. And it is proven effective in Tri-County, which is out there in Denver, Colorado area. Tri-County Public Health is the 3 counties in and around Denver County itself. And we do have a reduction, but we don't have really good statistics yet. I'll say that because it's only been less than 2 months. So they're waiting to get a more of a trend.
Obviously, we'd be interested in any numbers you can as
Yes,
they
sir.
evolve.
Yes,
We'd
sir.
like to hear about them.
You got it.
Okay.
Thank
Great.
you all.
Thank you. Thank you for joining. And we hope to hear more from you and see how this platform evolves. And as it does, we'd be happy to have you on again.
More than happy to. More than happy.
Good.
I want to thank Jing and Jonathan in particular. Thank you, guys.
Thank you.
Thank you very much. See ya.
So next, I just want to, Frank had to jump off. He was going to give a New York State update, but just so you all know, at tonight's New York State GIS Association meeting, he is going to give a statewide update. And if you haven't registered for that, I recommend you register. It's a 4 to 6 meeting, and Frank's going to be on there as keynote speaker, some awards. And to dovetail on the awards, I asked Dr. Gretchen Culp to join us today. She's actually the recipient of one of our GIS Champion Awards, and she's doing some great things in New York City. Actually developed a geocoding package for R, like I said, and I thought it'd be great for her to come on and talk a little bit about what she's doing in New York City. And Gretchen, are you there? Still on, Gretchen?
Can you hear me? Hello?
I can hear you loud and clear. Good.
Okay, great. All right, so I'm going to take about 5 minutes to describe how I've been processing COVID data. Okay, so my name is Gretchen, and I've been an employee of the New York City government for almost 15 years. As co-director of New York City DOHMH's GIS Center, one of my responsibilities is ensuring that our data are geocoded. Today, I will describe the process I use for cleaning and geocoding COVID data. I've presented this process at multiple venues, including the New York State GIS Forum, so it is likely some of you are already familiar with what I'm doing. About 5 years ago, I was tasked with developing a solution to process statewide planning and research cooperative systems, which is SPARCS, inpatient and outpatient data, which we receive annually. SPARCS data sets are quite large, consisting of tens of millions of records. As with many other New York City agencies, DOHMH uses GeoSupport, a superb geocoding software produced by the New York City Department of City Planning, DCP. GeoSupport returns over 1,000 fields ranging from borough to census block to the coordinate of a doorway. Note that GeoSupport is restricted to locations within New York City. While GeoSupport comes with a user interface, its binaries can also be leveraged from a variety of environments. As DOHMH has a very powerful Linux server running R, I use C++ to write a geocoding R package. The R server is currently running all 32 publicly released versions of GeoSupport, ranging from release 2012C to the current release 2020C, thereby enabling analysts to geocode legacy data. In order to take advantage of the Linux server's 80 threads, I parallelize by package so multiple geocoding sessions can run simultaneously. Now all the pristine addresses geocoded at lightning speed. Next, I had to deal with the more problematic addresses. Besides misspelled street names, I counted 13 different spellings of Amsterdam Avenue. Many of the original addresses were also truncated. I developed a system of string cleaning functions using DCP's street name dictionary, which I'm going to refer to from now on as SND, and their property address directory. or PAD. Every borough in New York City contains a street named Broadway, so these functions rely on a secondary field, either borough or USPS zip code. The functions are run in parallel and include the first function. Sequential address splitting is particularly important when a building or business name is included in the address. For example, DOHMH space 125 space Worth Street, Manhattan is broken down into 5 substrings, including DOHMH space 125, DOHMH space 125 space Worth, and so on. And finally, 125 space Worth space Street, which successfully geocodes. The second function is a spell checker, which uses the SND as the lookup. For example, 250 Bedford Park Boulevard, West Bronx, will correct to 250 Bedford Park Boulevard, West Bronx. The third function uses partial string matching to the PAD data set. 2 examples. 1 Franklin 11222 corrects to 1 Franklin Street. 1 Franklin 11249 corrects to 1 Franklin Avenue. The above examples would fail if we specified borough instead of zip code because both 11222 and 11249 are in Brooklyn. The fourth function uses regular expression matches against the PAD and SND data sets. So I noticed in the Sparks data and in the COVID data, there are a lot of errant spaces. And here's a typical address: 1 space 1 space 1 Ave. And so if you had 1 space 1 space 1 Ave 10003, it would correct to 11 First Ave. If you had 1 space 1 space 1 Ave 10014, it would correct to 1 11th Ave. The above example would fail if we specified borough instead of zip code because both of the zip codes are in Manhattan. Finally, addresses that still fail to geocode after being run through the string cleaning functions are then run through an IBM InfoSphere USPS verification service. We are hosting 5 of these servers, so I have parallelized this step to run on all 5 threads. A few additional things to mention. I've developed helper functions to allow analysts to geocode tables within their databases. The code runs within the user's secure environment, and addresses are flushed from the system once the session has ended. This is particularly important with highly sensitive data, such as not only Sparks data and COVID data, but our birth and death certificate data. Routine geocoding, such as with the COVID data, can be executed to run on a schedule, and I do run this every night, as well as a lot of my mapping and spatial analyses are done on a schedule. I've shared my code with several New York City government agencies, including ACS, CIDI, and NYSA. Here's some COVID-specific information. Once the data are finished geocoding, I perform checks to ensure that the addresses are not misreported. For example, a laboratory reporting its own address as the patient address, which has happened quite a few times. I use the building class code returned by GeoSupport, as well as a building level lookup table I created from geocoded 2019 USPS residential addresses for New York City, which was purchased from Melissa Data, a third-party vendor of USPS data. And I use this lookup to flag suspect addresses. DOHMH analysts then investigate these suspect addresses further. A combination of GeoSupport output fields, including tax law ID, which is the BBL, building ID, which is the BIN, and standardized unit is being used to pinpoint multiple cases within a household. We release our data publicly at the modified zip code tabulation area, or acronym ModZICTA, not at the USPS zip code from the patient address. Zip codes represent mail carrier routes, which are polylines. The ZICTA geography was developed by the U.S. Census Bureau for the 2010 decennial census as an aerial approximation of USPS zip codes. ZICTA are aggregates of census blocks. ModZICTA are aggregates of ZICTA. Typically, a small ZICTA is assigned to its larger neighboring ZICTA. For example, the ZICTA 10162, which is specific to the Pavilion apartment complex, is absorbed by the larger neighboring ZICTA of 10075, the Lenox Hill Upper East Side neighborhood. By using the census geography, we are able to incorporate American Community Survey variables into our analysis to produce measures such as case rates and testing rates. Information on the ModZICTA geography and geocoding processes is available on the DOHMH COVID GitHub page. Using geocoded COVID data, I have co-authored 2 manuscripts with DOHMH colleagues and Harvard faculty. First, Detecting Emerging COVID Community Outbreaks at High Spatiotemporal Resolution, and our Harvard colleague on that is Martin Kudorf. And secondly, evaluation of nowcasting for real-time COVID-19 tracking, and our Harvard colleague on that is Rebecca Kahn. I would like to thank Steve Oliver and Lynn Syrup at DCP, Matt Lipper at DoIT, and my wonderful coworkers at DOHMH. Thank you.
Hey, thank you very much, Gretchen. That's very comprehensive. I'd like to open up the Zoom meeting to any questions.
This is Al Leidner. Hi, Gretchen. That was
Hi.
really great presentation. Just recently the state came out with their micro cluster strategy and sort of, I guess, imposed it on New York City. But it sounds like you already had that kind of very detailed precision data to have crafted a strategy like that of your own, probably, and maybe far more accurately. Have you been doing this all along? I'm just curious.
Yes. Yes, Al. So we've been using SATScan, which is, and that paper is actually available, I think, on ResearchGate, the first paper I mentioned. And we have been doing cluster detection for many months now. And the paper I mentioned describes the first few months. And yes, our clusters do look a little different than what the state provided, but I have implemented tacked on a spatial join function at the end of my geocoding routine so that we can still report on those state zones.
Thank you.
I guess one more thing. You said you've collaborated with quite a few different agencies. Have you spoken with or collaborated with the state health department?
No, I have really little contact with the state health department. Not intentionally. I can't even remember actually meeting anyone from the state health department or communicating with them, but I'd love to share what I have. I do have a GitHub page where the sort of simplified versions of these packages are available for people who are running Windows on just a regular PC and not a souped up Linux server like we have at the health department.
Yep. Great.
This is Al again, just very quickly, could you send links to those two papers you've written with Harvard to Ross, who can distribute them?
Sure, my pleasure.
Great.
And I can include my GitHub link in there too. So if anyone I understand this is a New York State level call, so this might be of little use to many of you, but if any of you are interested in geocoding New York City data and you like using R, I'll give a link to my GitHub page as well, and you can download the address cleaning function and then the geo support function as well for R.
That'd be great, Gretchen. Thank you.
My pleasure.
Any other questions for Gretchen?
Say, Ross, just a comment. This is not exactly in the contact tracing realm, but it's related. We created a nationwide model that looks at, it uses an SIR model and models every county in the United States. I can send the link, but you can basically go to any county and take a look at the, obviously the current cases, but also estimated cases. And we use a fatality rate, IFR, of 1.156. And so just to give you an example, if you're looking at, say, New York City, let's see, let me go over to it. Can't seem to find it. Anyway, the number of cases is much, much higher when you actually look at a model prediction of the number of cases, which we sort of know, but it's useful to know what percentage of the population has already been exposed. And I know they've done some serial surveys of that, but if you take a look at the model, you can go to, and I could show you now if you'd like, you can go to each county and take a look at the estimates of the number of cases that occur and predictions of death rates out to the end of the year. So that might be of interest. I mean, I think if you're prioritizing areas, it's good to know what's the current status of that county in terms of how many people have been exposed to the virus already. And I think we all know the case data are grossly underestimated, So this is an attempt to take a look at, what does that number actually look like?
Well, Sean, do you want to share your screen right now? If you,
Sure.
I mean, we have a few more minutes. I have a few more minutes. It'd be interesting if you already have it up.
Sure. Let me.
Not to put you on the spot.
Okay. Can I share my screen?
You should be able to share it. Yep.
Yeah.
Perfect.
Coming through?
Yep.
Oh, okay, so this is what it looks like. And you see, you can sort of mouse over any region and we can zoom into the New York area. Oops, too much. And we could go to any county. So this is Suffolk County, and models looking at a diffusion of around 12%, meaning about 12% of the population has already had the virus. And it has a row of 2.56, and that gives you an indication of how sort of the spreadability. If one person gets sick, how many do they get sick? And you can see here the confirmed cases of 46,000 predicted based on a 1.15% fatality rate is 177,000. And actually, if you click on the county in the window on the left, you can actually see the model for that particular county. And for some weird reason, the number of cases decreased in Suffolk. I don't know if that's a data issue. I'm getting the data from the New York Times, but you can do the same thing for, so that's Suffolk. Nassau, you can see, has higher diffusion rate, 17%, with a higher row, 3.2. Obviously, Nassau is a significant bedroom community for New York City. And you have confirmed cases of 47,000, predicted of 235,000. And we can take a look at that, that model as well. Something weird happened there too. I'm using the New York Times data here. That's kind of a surprise. And so you could take a look at any of the counties. This is obviously New York City with all 5 boroughs. And so the models actually fit every county in the United States with the same algorithm, but it's using this recursive algorithm to find the parameters, the key parameters for the SIR model, which stands for susceptible, infected, and removed from the population. So I'll send this link along and you can take a look at it. In the lower left-hand corner, you can see the whole country. And basically, this is a summation of the entire, of all 3,200 some models. And here you can see, I'll just look at this one first. This is for fatalities. So in this case, the model is predicting almost 350,000 by the end of the year for the country. And this is the discrepancy that the model is finding if we assume a 1.15% rate. You know, everybody's using this number around 7.8 or 8 million, somewhere around there. And the model is basically estimating that it's actually around 18 million. So these are important numbers when you're starting to think about, you know, what has happened in that county when you're looking at tracing or, you know, other types of things like, you know, where should we focus our efforts for, you know, vaccinations and so forth. So I'll send the link around and you can explore it. If you're, you know, obviously this is the splash page, shows a little something about the model, but if you want to go into more details, this sort of goes into interpretation and how to use it. Yeah, so if anybody has any questions.
Yeah, that's great, Sean. I'm glad you brought that up. It's interesting. We're 8-9 months into this pandemic, and there hasn't been a lot out about people that have already had it, and then how the disease or the COVID affects people, could potentially affect them again. And seeing those numbers of who is already, the percentages of people that already have had it,
right? Quantifying
that, it'll be interesting as this progresses.
Yeah, I mean, if you look at the model and go to New York City, I think I showed it, 24%, according to the model using 1.15%, have had the virus in New York City. And so, like you said, we don't know if you can get it again and how frequently. I actually had it at the end of February and end of early March. Oh no, it was actually the end of January and early March. And I had dinner with somebody who just came back from China the Friday before I got sick. But we actually don't know all of those things. But you know, combine this kind of modeling with positive surveys can start to give us this information about, well, how many people have actually had this virus? Because we know there's a bunch who have had it, didn't go to the hospital. Early on, I didn't even know what I had. I just knew I'd never been this sick in my life. So yeah, so I'm updating the model probably bi-weekly. It takes about 24 hours to run on my computer. But it does show the next prediction will be out to February 1st. So you can take a look at that.
Great. Well, thank you, Sean.
Sure. And let me, I'll send that.
All right. I'll forward it to the group. Great.
I just sent the link in the chat window.
Okay. Great. Does anybody else have any questions or anything else? I don't have anything else on the agenda. On that note, oh, Mary, I'll send out the link to everybody on the chat, or everybody that connected to this meeting as well. So without further ado, I guess we'll conclude this session, and I hope you can all join tonight to the New York State GIS Association virtual event, an annual meeting. And on that note, anybody else have anything?
Yeah, this is Al Leitner. I'd just like to say that for those of you on this call who live in New York State and are not members of either the Gizmo or the New York State GIS Association, this would be a good time to join. This is an example, thanks to Ross, of what we can do when we work together. And the State Association and Gizmo have been trying to do that for the last 7 months. So please join if you haven't.
Great. Thanks, Alan. So we'll see you tonight, and we'll have our next New York State GIS Association Coven session in 2 weeks. So everybody have a good day. We'll talk to you soon. Thanks for joining.
Thank you.
Well done, Ross.